Right, so how do we translate all of the facts and figures and statistics and epidemiological studies and clinical trial data into understanding that guides our health policy, that guides an individual who must face a difficult health decision? Patients and clinicians are fundamentally operating at different levels. Patients experience outcomes. You live, you die. You are never 90% pregnant, right? You're never 90% alive. Physicians see populations. So that's the problem we've got to wrestle with. How do we take risk data and make it risk understanding? One of them is numeracy. Numeracy. What is numeracy? Well, if we talk about literacy, the ability to read, understand information, make sense of it, numeracy is the ability to look at numbers and make sense of them, to derive meaning from them. And when you're talking about risk statistics, that's a big issue. Now, if you want to talk about measuring numeracy, you're not going to give a patient a math test when they walk into the clinic, right? You can imagine that, sit down, put on the gown, now here, here's your clipboard, fill out the math test, right? That ain't going to happen. But I'm a big proponent of visual displays because rather than just require somebody to think in numbers, maybe we can help them look visually and understand risk. And so I advocate for what we call icon arrays. Icon arrays work better because you can count them, and you can see the relative height, and you can see the relative area, and those non-events are just as salient as the events. And when you use icon arrays, the research evidence over the last 10 years have shown it helps the less numerate make sense of numbers. Patient decision aids are the Morningstar reports of healthcare. And I will say that I believe they should be standard of care for health decisions that involve risk trade-offs, where the patient's values enter into the process. And if you stop and think about it, that's a lot of the medical decisions we all face.